안녕하세요. 닥터 고구마입니다. 오늘은 병원에서 어떤 리서치를 하는지에 대해서 알아볼 거예요. 영국에서는 백신을 그 어떤 나라보다 더 일찍 맞기 시작했어요. 하지만 백신은 치료와는 다르다는 점, 그래서 치료를 목적으로 하는 연구도 계속 하는 게 중요해요. 제가 중환자실에서 일을 하면서 몇 가지 트라이얼을 접하게 되었어요. 그래서 여러분들께 어떠한 연구들이 진행이 되고 있는지 알려드릴까 해요. 저희 리서치 팀 한 분을 모셔왔습니다.
We have quite a lot of trials happening at the moment. We have COVID and non-COVID trials, but due to the pandemic, most of our efforts have been concentrated on the COVID trials at the moment. So we have the RECOVERY trial, which is an interventional trial. We have the GenOMICC trial, which is looking at DNA. We have the pan-COVID trial, which is looking at it's data collection, looking at pregnant ladies, and we collect data from those who give us obviously their consent. And we also have a data collection study. We are collecting data for the government and Public Health England. It's happening throughout the whole of the UK, and they're the main COVID ones that we're doing at the hospital. Genomic study, so they're looking at the DNA of patients who are admitted into critical care, just to see if there is a certain pattern for susceptibility to be critically ill. So there might be one patient who comes in and gets to go home without going on ITU, with intensive care, or there might be a patient who comes in with COVID and gets severely ill, and they're looking at the genes to see if there's a difference between these patients. And that study is being carried out in intensive care. So the RECOVERY trial, it's an interventional trial. So it's UK-wide, so it's not just here, but they're looking at what treatments can help patients with COVID. When the trial first started, they had some different drugs on the trial, but as time has gone along, we've found that certain drugs might not work, so they've been taken off, or certain drugs do work, and they've been put into standard care. So one example is the steroid dexamethasone, which is quite a cheap steroid, and that's helped survival rate. So that's now standard care to give some dexamethasone to patients with COVID. And also recently they found out about a drug called tocilizumab, which we've also been given to patients, that also helps COVID patients. And now that's standard care as well. So it's quite exciting because we're finding things out very quickly. And they're then being implemented to help lots of people. So the current treatments that they're investigating in the RECOVERY trial is aspirin, blood thinner. They're also looking at an antibody cocktail called made by Regeneron. So they're manufactured in the lab. We're having a look at, and they're called monoclonal antibodies. There's another drug called colchicine, which is normally used for gout. So that's another anti-inflammatory that they're looking at. And baricitinib, which is similar to tocilizumab. So they want to see if baricitinib has an effect on patients as well. So RECOVERY, that's all over the hospital. You've got to be have COVID positive test or be clinically suspected to have COVID, and the clinicians who are helping us enrol these patients have to have a look and see that there's no contraindications for that patient to go into the trial. But really, that is it. So to start with, you had to be over 18, but now we've included, not at this hospital, but the trials included children and pregnant ladies. So it's trying to reach as many people as possible. Depends what they're having. So there's lots of different medications. Normally it'd be for 10 days, or certain drugs they have until they get discharged. It just depends on the drug, what they are randomised to get. So at the moment with the RECOVERY trial, it is an inpatient trial, so you'd have to be in the hospital as an inpatient, and it's the same with GenOMICC. But there are trials that are happening in the community as well. So there's lots of other trials, and if anyone wants to get involved in research, we have all our other clinical trials that we do normally when there's no pandemic. And if you ever are interested, the National Institute of Health research. If you have a look on their website, there should be a lot of the information on there to help, and you can have a look and see what you want to get involved in. So yeah.
Thank you. I think that's
Okay.
all the questions.
Okay, lovely.
you.
It's all right. Thank you.
Thank you.